Hello everyone, and welcome back to the School of Nursing. Today we're going to review how to give an antibiotic using the Alaris pump as a secondary infusion. So currently I have my patient running on normal saline at 50 mLs per hour, and I have an order for Azithromax 500 milligrams and 250 mLs to be administered to this patient. So really what I want to do is I want to make sure I grab my equipment first, and of course, as usual, you want to make sure that you do hand sanitizing first. And here we go. I want to make sure I grab my medications. I want to make sure I have the right patient, the right order, the right route, the right time. And once I've confirmed all of that, I am ready to go. So I've gotten my medication. I have my IV tubing. Okay. Remember that this is the primary Alaris pump. We don't need this one. What we need is secondary tubing. And I know it's always going to be secondary tubing because it's the only type of tubing that has this extra hanger in it. Okay? So I'm going to put some gloves on here. All right, so here we go. And I'm going to basically open up my tubing. All right. And I'm going to get started. So one thing I want to do is I want to make sure I close up my roller clamp. All right. And get my medication open. And I'm going to insert this in here. Oof. Not a good sight there. Here we go. And I'm going to flip my bag over, and I always want to make sure I squeeze the hub a little bit just to get my fluid in there. All right. And then I am going to basically run it through here to make sure, making sure I have no air bubbles or anything inside the tubing. All right, I got that out. Okay. The other thing I want to do is I'm going to take Preventix, if that's what you have available to you, if not, alcohol. And I want to clean the hub, the port that I'm going to put in. So you just turn it 5 times nicely, 2, 3, 4, 5. And wait 5 seconds for it to dry. All right, so 5 seconds, and here we go. And now we're in. There's no right or wrong. You can open it up right away. You can open this clamp up when you're ready to infuse. There is no right or wrong way to do it. As far as this goes, you want to basically take this, right, and you want to take your primary bag and drop it below the secondary bag, because if you don't, all the fluid of your medication is going to go into your primary bag, and that's going to be a little bit of a disaster there now. So I'm going to bring this closer to you guys to see. I'm going to hit channel select on my IV that's running, because this is where I'm going to piggyback. Once I do that, I'm going to have the options on the bottom of delayed options, volume, duration, secondary, and that's what I'm looking for. So I hit secondary, and to my luck, azithromycin shows up right over here first. If I wanted any other drugs, I could press on this side and look through my drug library to find what I want. But for this tutorial, it's going to be azithromycin. I am doing non-weight based, okay, because I have an order with the amount. I don't have to calculate anything. It says 500 and 250, okay, that is my dose, right? And that's basically asking me, is this correct? And I'm going to say yes, okay. Drug amount is 250. Right, excuse me, my bad. We're going to clear that. It is 500, and my volume to be infused is 250. Okay, and I'm going to hit next. All right, now my rate is how long I want it to go over. So if I wanted to go over an hour, I'm going to put my rate at 250, right? And that's going to be volume to infuse 250. Duration, so I can click rate or I can hit duration. I want this to run over 60 minutes, okay, and then basically I can hit start, and there you go. There goes my infusion. All right, guys, that's pretty much it for this tutorial. So this is going to run in, and your primary line will take over once this is finished infusing. All right, guys, that's it for today. Bye.